These are the different signs of symptoms of cerebellum. So hypotonia means decreased tone of the muscles. The tone of the muscles are related to the number of the muscle fibers that are active, and in this case, it's not many fibers are active. This equilibrium is the problem with the balance. Important, you know, that cerebellum is involved with the tone of the both trunk and limb muscle. So if the tone is gone, so the person may lose balance. This arteria is a problem with the speech, and those are related to the muscles in the jaw. So this proprioceptive information is not processed properly. Dystaxia or ataxia is a lack of coordination. As always, as not, I shouldn't say always, but mostly is a presentation of the cerebellar diseases. So here the person is not able to properly coordinate the movement. So they are, for example, when they walk, they have a problem walking. So the different muscles move and they cannot coordinate the sequence of the movements. Dysmetria, there is an inability to stop in a specific area. For example, you want to, an example that they usually tested in doctors, they tested in their clinic, is that the doctor asked the patient to, so the patient can touch the doctor's hand and the patient's nose. And when the eyes are open, the patient is able to touch the doctor's hand, but when the eyes are closed, the patient is not able to touch the doctor's hand. And you can practice and you can see with each other, not at this time, but when it's available and when the situation is good, you can practice with each other, and that way you will know that even if you close your eyes, you can touch your partner's fingers, but somebody with cerebellar disorder cannot do that. Intention tremor is that this is rapid involuntary movements. So all this says here voluntary movement here, it means that is the skeletal muscle, but the actual movements are involuntary, so it's not purposeful. It is rapid alternating movements. And this the kinesia is that the best way to understand that is when they tested, they asked the patient to sit on a chair and rapidly flip his hands, so while he's flipping his hands, he can hit the palm of the hand or the back of the hand, alternatively on top of the knees, on top of the thighs, actually, not knees. So rapidly they can move it back and forth, and somebody with the cerebellar disorder cannot do this kind of movements. And nystagmus is that it can be vertical or horizontal, and it's just irregular movements of the eyes. So maybe I will show you the dysmetria. Maybe it's actually it's easy. Some of these ones I can show it to you when we meet. Okay, so it's a little bit difficult to explain it. It's easier when you see it. The anterior, there's some diseases, anterior vermis or anterior lobe syndrome. This is usually happens in the anterior lobe, which is processing information from lower limb and also upper part of the vermis, and it's common in patients that are abusing alcohol. It's mainly affects the lower limbs, so the gaits are affected and limbs, and sometimes also affects trunk activity, and then there is a problem with the coordination of movements. Posterior vermis, the name is posterior vermis, but actually involves flocculonodular lobe. So this happens in children that have brain tumors like medulloblastoma or ependymoma, and they have usually Um, this they usually have a truncal instability and problem with the balance. Some patients also have nystagmus. Hemispheric syndrome, as the name is obvious, it is in the hemispheres, and usually is a space-occupying lesion like a abscess or a tumor, or it can be a hematoma. There is a dystaxia or ataxia in a different parts of the body. It can be in upper limb or lower limb or in the trunk. And usually the lesion is ipsilateral because the fibers from cerebellum is usually going to ipsilateral side. Phenytoin is anti-seizure medication, and the side effects are, cerebellar, lots of cerebellar conditions, so ataxia and nystagmus, gait problems, and also problem with the speech. So there are other medications that they give nowadays that are less toxic. The tumor of cerebellum, there is one astrocytoma, which is more common, and it's involved cerebellar hemispheres. The other one, which is less common, is called medulloblastoma, and that is involving vermis, and both of them are common in children. And lastly, cerebellar atrophy. So this is an autosomal recessive disease that is causing ataxia, problem with coordination and balance. But interestingly, they also have sensory deficits. So most likely is the proprioceptors, but they can also have other sensory deficits. So if you have any question, we can talk about it when we meet. Thank you.